Okay, class. From the previous videos, we have discussed the history of Chinese medicine. We have spent a few periods to discuss the thousands of years development of Chinese medicine. Specifically, we discussed the recent 2,500 years development. From these discussions, we will understand that how Chinese medicine from initial stage to develop until today. From this video, we are going to talk about the basic theory. The basic theory, as we mentioned previously, most of the content in this topic on the basic theory is from Huangdi Neijing, so one of the classic which was written in the period of 475 to 220 BC. Before we go into the detailed information of the basic theory, there are two questions that we need to clarify. The first question, what are we going to study in these few years? The second, how to study. Let's think about one scenario. I believe that most of us should have the experience of seeing a doctor. When a patient comes to the doctor, you will have a brief conversation during the consultation. After the conversation, the doctor may perform physical examinations. Afterwards, the doctor also may send you for blood tests or other examinations. Afterwards, the doctor will prescribe some medicine, and then you're going to go to the pharmacy. You're going to take the medicine. You're going to get the medicine and take the medicine according to the instruction. And then afterwards, the disease may be healed or may not. So in this whole process, from the diseases, and then you see a doctor, and then you take the medicine till the disease was healed. In this whole process, what are involved? So firstly, the doctor must understand your symptoms. What do you experience? For example, you got stomach ache. What kind of stomach ache? What does these symptoms means in terms of the diagnosis? What are the possible causes of this stomach ache? So these are the way of thinking of diagnosis. These will happen during the consultation. The doctor, in order to gain this ability, he needs to understand your symptoms. You need to understand the causes of these symptoms, how to analyze in theory. After the diagnosis, the doctor may have possible thoughts or a possible conclusion of your disease, and then he will prescribe the medicine, and then you're going to take the medicine. In order to prescribe the medicine, you need to understand the medicine. You need to know the function of the medicine. When you prescribe more than one medicine, you need to understand the relationship between or among different medicine, different drugs. Can you use together, or are they supposed to be used together, or are they not supposed to be used together? So this process will involve in the indications of different drugs and the relationship of different drugs. As we discussed before, that's the purpose of our study. In the end, you're going to be registered as an acupuncturist, as an acupuncture practitioner. So you will involved in this process eventually. You're going to see patients independently, which means you need to know all information that we have mentioned just now. So in order to have this ability, you need to understand the theory of Chinese medicine, how we understand the symptoms. If a patient for stomachache? What are the causes? What are the possible causes? Diagnostics. From these two, from the basic theory and diagnostics, these two we cannot separate them because these will happen at the same time. And after the diagnosis, you need to, instead of using drugs from conventional medicine, we are using acupuncture. For Chinese herbal medicine, we use the herbs or acupuncture. So these two are our treatment approaches, therapeutic approaches. For our degree, we focus on acupuncture. So we need to understand the indications of acupoints. We need to understand the indications of the meridians, how to use acupuncture or how to use the function of different acupoints to treat diseases. So this is one of our focuses. And then, since we study acupuncture, why we need to study the materia medica and the formula, medicinal formula or herbal medicine formula? These two we're going to introduce briefly, so you will have not full course of these two. You're going to have a general introduction to Chinese materia medica. You're also going to study a general introduction of Chinese formula, herbal medicine formula. The reason for these two information is because that's these two information you will have the thought how to organize the acupoints. For example, point 1, point 2. So we're going to use the name because we haven't go to the acupoints. 1 point, the second point, the third point, you may have 6 to 10 points in one prescription. So how do you formulate this prescription? What's the relationship between point 1 and point 2? Why I choose point 3 instead of point 4 in this prescription? So this thinking will be from the formula, how to formulate a formula. That's why we need to have a basic information. We need to understand the basic principles of prescribing the herbal medicine, the basic principles of formulas. Then you will make your acupuncture prescription much better and much more flexible. So that's our foundations in order to treat diseases, in order to see patients. These are the foundations. And then after these foundations, we're going to focus on internal medicine. Internal medicine, from this study, if we will study the diseases, for example, hypertension, or headache, or asthma. How do we understand asthma in Chinese medicine? How do we understand flu or common cold in Chinese medicine? So that's internal medicine. For internal medicine, we will study quite a few different specialties, the different diseases in different specialties. So we're going to understand what are the causes, what are the possible causes, and what are the pathogenesis, and how to treat them, which points are we going to use. So these will be from the internal medicine. And afterwards, after the internal medicine, we understand the diseases, we understand the possible causes, and then we're going to focus on the therapeutics of acupuncture and moxibustion. From the therapeutics, we're going to focus on the treatments that's based on acupuncture and moxibustion. So that's also the purpose of our program, the aim of our program. So we will focus on the treatments based on acupuncture and moxibustion. So these are all the different contents or different subjects that we are going to study in these few years. After gaining all this information, you will be able to practice independently. And then when we go to the next question, since we need to study all these informations, from the history, we already studied the history. You have a full picture of the whole development of Chinese medicine from the very beginning until today. And then we're going to focus on some information there, and then how to study. The next question comes to here. According to the learning theory that is proposed by Miller, in order to action, in order to do something, in our situation, in order to see patients independently, you need to show how. To show how to do something, that's your performance. This performance can be reflected from our conversation during our study, especially in our online tutorial or in our contact classes. Between our conversations, how you ask questions or how you answer my questions, that's one of your performance to show your performance. The second is from your tests, either from the written assessments or the practical assessments. You need to show your competency in your performance, in your test. In order to perform well, you need to know how. That's the competence. You need to know how, that's why you need to study. That's your knowledge. The basic theory, the diagnostics, the acupoints, the meridian. So these are the knowledge you're going to study. You need to know. On the next slides, we will be more clear. What does it mean by know? This know doesn't mean you knew something. Doesn't mean you know something, but you need to memorize. Another theory that's in education field is the knowledge. We mentioned in the previous slides, the knowledge. What are you going to do with the knowledge? The first thing you need to remember. So you need to remember the theory. When we talk about yin and yang, when we talk about the 5 elements, or when we talk about different zones, you need to remember the terms, the definitions, the indications. Remember. After remember the knowledge, you need to understand. Comprehension. You need to understand. After understanding, you need to apply in your daily life or in your assessments. So that's applications. And in future, you're going to apply in the clinics. Analysis. When you see patients or in our case studies, you need to analyze the information through the knowledge, through the understanding. This understanding is not based on your understanding. This understanding is based on the knowledge. So that's the difference. I got one query in 2020. There was one student says why she got very low mark in the summative test. And as she understands, she has done what she can, the best she can, and she thought she understands the case well, she answered the case study well. However, she failed in the test. The reason for that is she answered the case study, she answered the questions based on her understanding, not based on the knowledge. So in order to understand, to have the correct understanding, you need to remember the knowledge that we are going to study. That's the foundation of understanding. That's also the foundation of the application and analyzing. evaluations, creating. As you can see, creating, to create something, you need the foundations. You shouldn't sit and think by yourself and try to create something. That's also one of the situation in our study. As we can see from the history, from Chinese medicine history, for these thousands of years, everyone tried to create something out of the system. Everyone's very confident about their self. They try to create something. They try to create something to add, to improve Chinese medicine or to modernize Chinese medicine. That's another very common debate in Chinese medicine. We need to get rid of the old knowledge. We need to create something to make the Chinese medicine modern. So in order to create, as you can see from the theory, you need to know the knowledge. You need to understand the knowledge. You shouldn't create from somewhere else. That's why you need to base on our study. You need to base on the medical books. You need to base on the textbooks. From here, we also can answer one of your questions that in 2020 there were some students asking. We use the continuous assessments. So each chapter, after each unit, you will write very small spot test. After writing the spot test, and then, for example, in March, you're going to write one spot test about 10 or 15 questions, some very short questions. In April, you're going to write another spot test, and then eventually when we go to the end of the year in November, you're going to write a summative test. The spot test will consist of the questions in the specific units or specific chapter. For example, the spot test 1 will consist of chapter 1, spot test 2 consists of chapter 2, and then in the summative test, you're going to write a test that covers the whole information from February to October. So some students ask, we have written the test on specific chapters. Why we need to write a summative test at the end to cover the whole information? The reason for this is in the summative test, we need you to remember. We need you to show your competence of remembering, that's the foundation, of understanding, that's the second level. You also need to show me your ability to analyze the case, to apply your understanding based on the knowledge to analyze the clinical situation. At the undergraduate, especially at the undergraduate level, we don't need your creation, we don't need your evaluations. However, you have to focus on remember, understanding, applying, and analysis. And after the undergraduate level, you can go further your study to evaluate the knowledge, to create something in this field. So no matter what you're going to do for your further study or not, your further study, or for your clinical practices, you need to remember, you need to understand. The reason why we're showing you this picture, that's also another very common debate. That's the term or the knowledge that we are using is very difficult to understand. So some students, they try to remember, they try to understand first and then remember. I always told them that you need to remember before you understand. That's a bit tricky. The reason why saying so is when you try to understand something that you don't know or you are not familiar, you will understand based on your understanding. Once you base on your understanding, you will remember your old words. So if you do this first and this the second, you're going to remember your old words based on your understanding. However, this understanding may be wrong, or most of the situation you may be partly correct but partly wrong, and also it may leave some information, some important information that you don't understand, or that's more difficult to understand, and you forget. That's why, for our study, you need to remember the term first. Remember the categories. For example, in future, when we talk about the heart function, for the heart function, we said the heart governs the blood and vessels. The heart houses the mind. So for these two terms, you might not understand what does it mean. Doesn't matter. Remember them. Remember these two characteristics. The first, the heart governs the vessels and blood. The second, the heart houses the mind. So after remember these two terms, after remember these two definitions, you're going to watch the videos. You're going to listen to my analysis. You're going to read the textbooks that can help you for your further understanding. And then in future, after studying the diagnostics and after the practical assessments and the exercises, you can apply and analyze. So that's the flow of studying. You need to put effort in your study. You need to remember them. How to study the basic theory. These steps you actually can apply to all your studies. Step 1, you need to memorize. You need to memorize the knowledge. For example, in future, when we study the 脏腑 organs, the function of the organs, the first organ we're going to introduce is the heart. The heart, from Chinese medicine, we said that the heart has the function of governing the vessels and blood. The second function, the heart can house the mind. So the heart houses the mind. You might not understand what does it mean, govern the vessels and blood, or house the mind. You might confuse. It doesn't really matter. What you need to do to memorize, to remember the tones, remember these tones, and then you're going to watch the lectures. You're going to attend the contact classes. You're going to read the textbooks for your further understanding. You're going to hear how I explain these different tones to assist your understanding. After understand, you're going to practice. The practice doesn't mean that you're going to study for a few years and then you're going to practice in the end. You're going to practice in the 4th year, or for the postgraduates, you're only going to study, you're only going to practice in the 2nd year. No, I don't mean that way. The practice, you need to apply your knowledge. That you are studying every day. You need to apply the theory in your daily life. For example, a few days ago, we got the summer solstice in South Africa. The summer solstice, that on that day, we have the longest daytime and shortest nighttime. What does it mean, the day and night? And from the 2nd day of the summer solstice, the daytime is shortened. The daytime will be shorter and shorter day by day, and the nighttime will be longer and longer day by day. What does this phenomenon means from our theory? How do we understand from the theory? So as you study, you can use this theory to analyze the phenomena that's around you. And the more we study, you will understand more that Chinese medicine, we learn from nature. So we can use this theory to analyze the phenomena in the nature. And of course, we can analyze the phenomena on human health. So this will guide us to the other question, why Chinese medicine called natural medicine or traditional medicine. The natural medicine doesn't mean we use herbs, we use acupuncture, we don't use drugs, we don't use chemicals. The natural medicine is actually because the theory, the laws, the principles that we use to analyze human health based on nature. We learn from the nature. For example, when you see in spring, all the trees, all the grasses going to grow, and the trees turn green, what does it mean? From the theory, when you see in winter, the leaves going to fall. When you see the old age, the old ages or the senior people, they become shorter and shorter. They become more skinny. What does it mean from the theory? Can you find something similar from the nature that can apply in our human health? So that's the practice as we study. Practice as we study. Don't wait until the end. That's from the nature, from the environment, and also I trust that most of us, we will have diseases sometime, such as common flu, stomachache, headache. Some of your friends and your families might not be that healthy, and some of you, especially for the postgraduates, you already start seeing patients. When you see a patient with stomachache, when you see their tongue, you see a yellow color on top of the tongue. What does this mean from the theory? Although before we study the acupuncture and moxibustion, the acupoints and moxibustion, or the meridians, you might not be able to treat them. But from the theory, how do we analyze this practicing? The more the better. You can't be too good to practice. So the more the better. And also in future, we will study the pulse taking. To take the pulse, also practicing. No excellence can be acquired without constant practice. So practicing is very important. The more you practice, the better you will be. In this video, we mainly answer two questions. What will involved in our study and how to study. From the next video, we're going to introduce the development of the basic theory, and from this subject or the topic, we're going to focus on the theory. So we're going to discuss the theory in details. And this theory we're going to use as long as you practice acupuncture. You are going to use the theory. So these theories are very important. You have to remember them. Thank you for your attention.